when I hear an author talk about changing the diet and they show me the studies, I get very excited and I think, wow, this sounds great. But then when I heard you today say things like sleep, exercise, emotional health, and sunshine could help, I'm thinking, does everyone just say that because it's like, it's be positive, have community, get sleep? Like it sounds like, yeah, that sounds nice. Is that fluffy? Like is sleep a fluff thing? Like do I really need to get 7.5 hours? Can I get less? Do I really need sunshine? Do I really need to be emotionally healthy? Or can I stay angry? Is exercise really a big deal? Like is this like, feel good type of stats, or is this hard data that will prevent Alzheimer's?
Do I look like a fluffy guy?
No.
No, okay.
No, one of the advantages of living at this day and age is that technology has helped us identify markers of disease and markers of lifestyle better, and these concepts are not fluffy anymore. I remember, and I'm not that old. I graduated from fellowship in 2015, and I remember that a lot of the professors and doctors used to laugh at the concept of meditation and sleep. I mean, we took pride in not sleeping. It was like a competition. You slept 4 hours, I slept 3 hours. It was like that. But now, with markers of inflammation, with neuroimaging showing inflammation in the brain, with, blood tests that show oxidative damage to the brain, we actually can measure how these lifestyle factors, such as sleep, such as meditation, having love and community and sense of belonging in a community, how all that actually affects your brain health. And they're incredibly important, to the point where sometimes we kind of, put down nutrition a little bit so that people can pay attention to all of these other things. So yes, nutrition is incredibly important, but if it's not done in the context of a complex, multifaceted approach, which looks at exercise and which considers stress management, my goodness, the changes in your cortisol and adrenaline levels and how that affects your hippocampus, which are the areas of the brain that encode memory, and how it shrinks your brain. If you don't consider that, then it's not a complete health approach.
Sleep apnea is epidemic. Sleep apnea is lack of oxygen to the brain. If you have sleep apnea, you could eat a truck full of kale and it won't do any good.
I'm glad you got real fluffy and we got love finally. You actually said love.
Yes, absolutely.
She's sitting next to me.
There are a lot of studies that having a partner brings longevity in general. Yes. Apparently there's many different kinds. And it's interesting. I mean, we human beings, we're meant to take care of each other. We don't do all that well on our own. And even something as simple as the rate of death from, I'm blocking on that terrible skin cancer.
Melanoma?
Yeah, on melanoma, people do better if they have a partner. And one of the reasons is that a loving partner is likely to spot your melanoma before you do. So there's a lot of different ways that we humans take care of each other, and there's a lot of research on it. I have not, incidentally, I've been so busy fighting the drug companies, the shock machines and all, that I haven't put together as much as I want the data on love. But there's a lot out there that suggests that.
Absolutely.
You've seen that. You talk about that, about the relationship and longevity, because you may have researched it more than I am, I'm sure.
On the negative side, people who have, I go back to the negative side. People who have dementia, their partners, their caregivers, die 60% faster than the patients.
Oh my.
But also, people who are married actually have lower rates than people who are not married as far as dementia is concerned. They can push the disease further back. So the commonality is very important, how we share. What is the common factor? Why would two people who are married, if a partner has dementia, their other partner has a 600% increased risk of developing dementia as well. That's not genetics, not in most part of the country. I'm from Pittsburgh, so. Yeah. But why? So what's going on? Shared risk factors, food, even activity levels, even energy levels, stress levels. Everything is shared, and they contribute to 600% increased risk in the other partner's the disease. So yeah, and on the other side, love, as far as chronic diseases, it comes up over and over again. When you have a partner, in fact, we have a brain assessment. One of the questions we ask is marital status and love and connectivity, because it's been found to be that significant when it comes to cognitive diseases.
So if someone is depressed, and there's two choices, and you could say someone depressed or even someone not depressed, how real is sunshine? Is that just like, it means nothing? Like, should I go out of my way to stop being productive each day and go take a 45-minute walk and get sunshine? Is that like critical, or is that like, it's nice, but it doesn't really affect your life or your health, or should I take an antidepressant? So for depressed people, do you recommend antidepressants? Do you recommend walks in the sunshine? Do you recommend both? What's your thoughts?
Do I have an hour? We now know from the controlled clinical trial where we've looked at, even with the drug companies trying their best, and let's say they do 6 trials and they come up with 2, which is what the FDA needs. So they get 2 trials that the FDA thinks are good, and they get the approval, and they get 4, 5, 6 they've
Talk
done.
into the mic. Talk right into
We
the
get
mic.
4, 5, or 6 that they've done that they're not using. First of all, that's not science. I mean, the whole process is evil. The whole process is wrong. It's bad. It's calculated to sell poisons
The tattoo today.
to people. But now we're doing meta-studies. Some of my colleagues have been doing the meta-studies where they get all the FDA studies. And when you get all the FDA studies for antidepressants, they don't work. They do work. It's depending on the studies, 30, 40% improvement. But it's the same improvement as the placebo. Now, if you give a sugar pill, that's the data. But suppose you give a placebo that gives you a dry mouth and blurry vision, in which case you think you're on a drug, and the doctor thinks you're on a drug, because double-blind doesn't work. The doctors can figure out who's taking Prozac and who isn't, or who's taking whatever drug, because they all have side effects you can see. But if you take an active placebo's better. And it isn't killing anybody. I think that the entire antidepressant thing is just a giant fraud, so just forget it. And some people get a brief high from the brain damage. I mean, why does a person get euphoric and feel the best they've ever felt in their lives after they've been on a pill for a day or two? That sounds like a catastrophe. And it's often a harbinger of mania, a very destructive process. Or people get apathetic and they feel finally they're not suffering. And I've literally, most of the people who come to me are on drugs. Most of the people come to me to get off drugs, so I'm dealing with drugs all the time. And you have the husband who's been brought in by his wife, and she's just desperate. He doesn't love her anymore. They don't have sex, but they don't have romance. They don't have love. And she says to him in the office with me, "You don't even love the dog anymore." And he says with heartfelt, "But I don't feel like killing myself." So he's got this idea in his head that it's either kill himself or take these drugs. But somebody who comes into a therapist or a nutritionist, I think, or a trainer who's full of optimism, because what is depression? It's hopelessness. It's, I see no way out. And it's so bad the way I am, I want to kill myself. And that can last for 10 seconds and people kill themselves. People kill themselves on the first dose of Paxil. I had cases like that. The destructive forces make them so crazy, they can't imagine living. So you give hope, you give love, you give optimism, you remind the person on the first visit what their assets are. So most therapists on the first visit, they're taking some notes and they're finding out all the stuff. And I like within 3 or 4 minutes with a depressed person to, tell me about your assets. Tell me what you've done, whom you've loved. I'm right away looking at the future and who they are and finding things I like about them, because it's all about hopelessness. And it's actually, depression's one of the really easy things to treat if you are not depressed. In 1968, I got divorced and I was depressed. And it was the only time I had suicide attempts in my practice for 40 years. Never again. And then I had one more.
Talk to the mic.
I had one more, I don't know, 40 years later with somebody I barely knew who just called his wife and she said, "I'm leaving you." And, you know, he wouldn't come in the office. He wouldn't go to the emergency room. I said, can Ginger and I come over and pick you up and take you to the office? And he said, "Oh, yeah, we'll do that." So, and we got him through all of that. But, you know, an interested, caring, involved human being is what depressed people need. And it isn't necessarily therapy at all. People do it through religion. They do it through exercise. They do it through nutrition. And a lot of the effects we see that we attribute to something are actually the human interactions surrounding them. You've heard me speak, so you know that Pam's diet changed my entire physical health and got my wife over ulcerative colitis. So you know I'm a believer in that. But people will say, for example, my child was depressed and I took away his yellow dye number something, or my child was hyperactive and I gave him a new vitamin or something. But what's happening there, it's the first time the parent had the moral courage to actually tell their child to do something and to know they were right. And they had to do it. It doesn't matter what it is. Once you get involved with your child or your loved one actively, it makes things go better. So, yeah, if we just tapered people, we could throw away the antidepressants completely, move toward exercise, nutrition, and anything, and not just therapy, anything that raises us spiritually.
As an answer to you, wonderful. One of the best things you can do, and this is not soft, it's data on exercise repeatedly has shown that exercise is better than any antidepressants.
Oh, yeah.
And then sunshine. So I say a morning brisk exercise with a loved one is the best medicine you can have. You have the social component, you have the exercise component, you have the light component, and that does work. These are not soft concepts. You take each of these independently, there's data. Combine them together, there's definite data. Create a community, that definitely is effective. We met thousands of miles away while she was with Doctors Without Borders and I was with US Forces and the World Bank. We went to Afghanistan, and I was in Reston, Virginia, and Bethesda, Maryland at the time, NIH. And every patient that would come to me would be on antidepressant, especially the women in Bethesda, lots of antidepressant. Then we go to Afghanistan, and I'm creating the most successful women's empowerment program in the world. It's actually published. And we go to this place where women are not even allowed to leave the close surrounding. And I'm offended at many levels. We won't get into that part, but whatever it is. And I tell you, I felt more laughter and heard more laughter in that little enclave than in Bethesda. What's going on? Obviously, that's not good, obviously. And I did everything in my power to whatever. But it was community. Community, any kind of community you can create is the most effective thing you can do. Community is everything. In fact, the blue zones, the common denominator of blue zones, as much as we would like to say nutrition, and it is a big factor, as much as we would like to say anything else, it is community, whether it's religious community in Seventh-day Adventist or other kinds of community in Japan and Nicosia and other places. It's community. Building community is the most effective antidepressant.
And
by far.
I think loving community, too. I think we need to distinguish, because nowadays we have a lot of hating communities, and we have to, it's got to be loving community, for sure.
That's true.
Not politically centered.